All right, thank you so much. Welcome to another episode of the Love, Hope, Lyme podcast. My name is Fred Diamond. I'm the author of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. We're going to be talking to Nikki Schultek here in a few minutes. I want to just remind people that this show is not a replacement for medical treatment, although we're going to be talking about Lyme disease and co-infections and how it relates to you. If you are struggling with Lyme disease, I urge you to please see a Lyme Literate Medical Professional. This show is on Apple Podcast. If you're listening on Apple Podcast, thank you so much. Go up, give us a 5-star review. We would greatly appreciate it. If you're watching this on YouTube, thank you so much. Go up, give us a thumbs up, leave a comment. We'll get to all of them. Nikki, some of my shows have gotten like 100 comments and people are really taken to it. So I greatly appreciate that. The book, Love, Hope, Lyme, is available on Amazon. If you'd like personally signed copies, Nikki, I've signed, I don't know, thousands of copies. Please reach out to me via social media, Fred Diamond on Facebook. And Nikki, I spend a lot of time on LinkedIn as well, as you know. Please feel free to reach out to me. I would love to get you a copy of the book. And Nikki, I've made the PDF of the book free from day one for chronic Lyme survivors. So if you're a chronic Lyme survivor and you like the PDF of the book, please reach out to me via any of the social media areas, and we'd be happy to get a copy of that to you as well. So Nikki, I'm excited to have you here today. We have Nikki Schultek, and Nikki, you and I met at the ILAD Scientific Conference back in November last year. And again, we're doing today's recording in June of 2025. And you're doing some very interesting things that relates to infections and dementia and Alzheimer's. And a lot of people listen to the show know that we did an episode with Nicole Bell, who of course wrote What Lurks in the Woods. You can go up on YouTube or Apple and search her personal story about her husband and Lyme disease and Alzheimer's. But I'm excited to talk to you. You're doing some amazing work, and I'm really curious about what you're discovering and how the tie between Lyme disease and other infections and dementia and Alzheimer's. So give us a little bit of an introduction, tell people what we need to know, and then we'll get deep into this.
Absolutely. Fred, thank you so much for having me. I'm so grateful. Thank you for writing your book, for your advocacy, and just for, in general, putting information out there to the world that people need to hear. So to everyone listening, I'm very thankful to be here. The reason I sit in front of you today is with my own experience with chronic infection that was nearly 10 years ago when I was in my early 30s. Today, fast forward, to 2025, I find myself with numerous different hats that I wear, but the way that I describe the work I do is that I'm a collaboration architect. So I bring people together that might not normally work together in science and innovators to basically understand how do chronic infections impact the brain. And really, in order to understand the impact that things like Lyme, which is a bacterial infection, other co-infections of Lyme that vary, things like viruses that we might pick up over the course of a lifetime, even fungal infections, how these things might cumulatively actually impact a chronic neurodegenerative disease like dementia, of which Alzheimer's disease is the most common form. But also, essentially by bringing together different groups of researchers that might not normally collaborate, effectively what I'm calling it is bridging silos. And I really noticed that that needed to happen when I became acutely aware of it was when I was sick 10 years ago. And I was kind of like a lot of Lyme patients or chronic infection patients hopping around from one specialist to the next. And I had all of these different diagnoses, and they were really just descriptions of my pain and discomfort. They weren't answers as to the root of what was causing it. And I'm sure that's something you hear a lot of, right, Fred?
Yeah, absolutely. It's you know, getting to the root is so critical because, as we know, Lyme disease can represent, some people say 40 different symptoms. I've seen people who've said 200. I don't know. That's kind of a high number, but it's definitely a couple of dozen. And initially when people are diagnosed, it looks like something else, like obviously arthritis or the flu. And then if you're a doctor who's trying to do your job without thinking too hard, they could say, well, let's treat the arthritis or let's treat the cure. I want to get one question out there right away because a lot of the conversation is going to be framed from this. can infections cause Alzheimer's for a subset of patients? Again, I referred to Nicole Bell and her book before, but give us a little bit of a deeper answer. And then I want you to, whatever you want to share about your journey, a little more deeper and how that led you to start, AlzPI, and, you have the new center at the College of Osteopathic, whatever it is you want to say about your journey and how it got you to where you are right now.
Yeah. Yeah, so let me talk a little bit first. I'll mention the hats I wear. So, I started Intracell Research Group in 2017 on the heels of my own experience with chronic infection. I had Lyme. I have Lyme co-infections, and I also had a chronic respiratory infection called chlamydia pneumoniae.
Hmm.
It's not the sexually transmitted chlamydia, but it's a bacterial infection that you pick up from people coughing. It's incredibly common. The exposure rate is super high across the human lifetime. So chances are, if you're between the ages of 50 and 80, you've had the infection. Anyway, that infection, like Lyme, has been linked with other chronic diseases, such as severe asthma, particularly asthma that doesn't respond well to inhaled treatments. I had that at the same time as I had the onset of my Lyme symptoms. So, the different hats that I wear. So, I started Intracell Research Group. It began as just a small group of doctors that studied this chlamydia bacteria that you could inhale, the respiratory chlamydia, and different chronic diseases it had been linked with. So I always like to joke that I arrived to the sort of chronic infection space riding the chlamydia train, which is only funny when you're in a room full of scientists, perhaps, or people who like to talk about germs. But then quickly realized, of course, with my own experience, figuring out through testing that I had Borrelia burgdorferi and that some of my other symptoms, like air hunger, were linked with Babesia infection and rib pain and all these chronic bladder pain disorder I had, and joint pain and memory issues and cognitive changes. Um, Fatigue, that all of these things were, potentially linked with not just my own immune system or quote autoimmune diseases, which I was being diagnosed with one after the next from different specialists, but rather tied to an infectious process, my body's response to something that's happening, right? Like acquiring an infection. So I started Intracell Research Group, not really sure what it would become, all the way back in 2017. Just started connecting people to each other. And today, Intracell Research Group is my limited liability company. It is my consultancy through which I am organizing these research collaborations among different groups. We apply for NIH grants, we apply for philanthropy grants together, and I essentially am, the architect. I bring different groups together that may not necessarily have the chance to collaborate. I also co-founded and am the executive director of something called the Alzheimer's Pathobiome Initiative, or AlzPI. Now, that started to formalize just a few years ago. Decided to really zero in on the role of chronic infection and how it impacts the brain. Because, Fred, when I was sick, the thing that really was the most disturbing to me were the neuro and neuropsychiatric symptoms of my infections. I was able to come to terms with bladder pain. I went on sick for a year before I got a proper diagnosis. So I had come to terms with the fact that I wasn't going to sleep well because I had so much trouble breathing. I came to terms with my pain. I could not really wrap my mind around when my doctor told me that I might have MS based on my symptoms. And what really was sickening was the idea that I couldn't watch my kids grow up because I would be slowly robbed of my neurologic function, or I would be robbed of that which makes me who I am, my brain, my personality, my well-being. And my kids were only 3 and 5 when all this happened. So it was like I was spending time preparing, for the fact that maybe I wouldn't watch them grow up. And, my MRI came back at that time that I did not have lesions yet. But what my neurologist said, kind of coldly, and I was living in Connecticut, by the way, where Connecticut, literally where Lyme disease was discovered. Um, at no point did Lyme or infections come up on anyone's radar, all these different specialists, pulmonology, asthma and allergy, uh, GI. I had literally, cardiology, echocardiograms, because I had a cardiac arrhythmia. I had an infectious disease consult. I had a neurologist, as I said, because of I had the neuro and neurodegenerative symptoms. And at no point were infections on the radar. It wasn't until one day when I was so desperate and so anxious and like literally unraveling that I decided to do something on my own and start like researching, like fervently. And I decided to type in a Google search that ended up leading me down a path to figuring out what was going on. I was searching the relationship between my bladder pain disorder, which is called interstitial cystitis. A lot of Lyme patients will end up with bladder pain or incontinence or bladder issues. And actually, Lyme and other chronic infections can indeed cause chronic idiopathic bladder pain, meaning I can't stand the word idiopathic. It means we don't know, right? So got that a lot when I went to the doctor. So I ended up searching the relationship between that bladder pain disorder and my really severe and refractory asthma. And I came up with a paper by the physician who ended up saving my life. So his name, he passed away 3 years ago. His name is Dr. Charles W. Stratton. He went by Chuck, and he was the doctor that essentially published on the relationship between this respiratory bacteria, Chlamydia pneumoniae, and a bladder pain disorder. And it blew my mind at the time. I remember thinking, what do the lungs have to do with my bladder? Well, the funky thing is that certain infections, can actually enter your cells, the building blocks of what make us what we are, who we are, and including our immune cells, and go in and, like in the fashion of a Trojan horse, these organisms, bacteria, special bacteria, including Lyme can go inside our cells and actually be trafficked or transported anywhere in the body they would care to go, and then leave the immune cells and infect those areas. And so, this funny respiratory bacteria, it was postulated in the study that was published out of Vanderbilt, which is where Dr. Stratton was the director of clinical microbiology for more than 30 years and an infectious disease specialist. He was very concerned that this type of bacteria that hides inside our cells and causes chronic inflammation could indeed cause inflammatory diseases and get involved in things like asthma, bladder pain disorders, multiple sclerosis, atherosclerosis, which is heart disease, and beyond. So, this idea, when I did that search, Fred, I was like really kind of blown away, because the whole idea of autoimmunity is the concept that your immune system is attacking healthy parts of you for ostensibly no reason. But the idea that there's an invader there, that it's almost like the watchdogs, if you will, your immune system is barking, but you can't see them. And so, it's like it's an attack essentially on something that your immune system can't handle, because your immune system itself has been invaded. So this idea to me was super crazy and outlandish, but I decided to reach out to Dr. Stratton. I had previously worked in the pharmaceutical and biotech industry, so I knew how to read research, and I consider that to be a privilege. And I consider that to be very unfair, because it's not fair that I had work experience and an educational level that allowed me to access information and then get a hold of someone that other people may not have the chance to get a hold of. And so in contacting Dr. Stratton, to fast forward, he ended up suggesting tests for various infectious diseases. And I ended up, over a course of time, learning that I had multiple different chronic infections. And the question was, okay, I had worked in the pharmaceutical industry. Are these infections causing me to be sick, or are they merely in my body, but not the cause? And so I went on treatment to address the infections, and the treatment wasn't easy, but the ultimate result was that nearly every condition was put in remission. So I'm not exactly, quote, perfect, or I would never consider myself to be fully out of the woods, like a lot of misdiagnosed chronic infection, chronic Lyme patients would say. But I get to be here today for my kids who are now teenagers. I get to, work in research. I get to live a purpose and mission driven life, and be here with you today having this important conversation. And so when I started to feel better, I decided I needed to get involved. And that's how all of these different organizations, including our new research center at the Philadelphia College of Osteopathic Medicine, that I'm the founding director of, it's called the Pathobiome Research Center. This word pathobiome is really important because we all know, I think if you ask most people about a microbiome, they know what you're saying. Okay, the passengers living inside of us. Most people think about your gut right away when you say microbiome. And truth is, the whole human body is like, we're a community, right? We're filled with different things, viruses, bacteria, fungus, parasites. But the pathobiome captures a term that we believe our research group is really important because it refers to our passengers that might be making us sick.
Hmm.
Yeah.
Okay, so well, first of all, thanks for sharing all that. And you mentioned it wasn't fair that you had this background. Well, there's nothing fair about this disease.
No.
So 0.0 things are fair that anyone's even watching the show. That the fact that I even created a podcast called the Love Hope Lyme Podcast, it goes back to a lot of things that are unfair, but we'll address that on a different show. So thanks for sharing that. And it's quite a journey. Bring us back to Lyme and dementia slash Alzheimer's. And if you could do something before you do that, kind of describe, is Alzheimer's a dementia? Is dementia Alzheimer's? If you
Yeah,
don't mind, kind of give us a definition of what is
absolutely.
Alzheimer's, what is dementia, and then talk about, because I know a lot of people listening want to hear, where the tide comes in, because if they have
Sure.
Lyme, I'm going to guess there's concern about other things that can happen within your body. And I love the way you described how something totally remote can, bring you down to something just seemingly not even related. So define
Yeah,
Alzheimer's slash dementia, and then talk
sure.
about the connection between Lyme and tick-borne disease and Alzheimer's and dementia.
Absolutely. So I like to describe it as dementia as being the umbrella
Hmm.
over everything. And then Alzheimer's disease is the most common form of dementia. So
Okay.
it's the, major threat to our cognition. It's associated with aging, of course, but then there are also younger cases, like what happened with Nicole Bell's family and her husband Russ, which is just absolutely horrible. We know that, there are other types of dementia other than Alzheimer's disease, like Lewy body dementia, frontotemporal dementia, vascular dementia. And we know there are diseases such as Parkinson's disease that share certain features of dementias, like Alzheimer's. And so, what I'll explain for the audience is something that I think is important to understand. So, the diagnosis of Alzheimer's disease really refers to set of clinical symptoms, right? Like memory testing, coupled with now we have testing that can reveal, and it's not accessible to everyone, but some people are able to be tested either through having a scan of your brain or through blood testing or spinal fluid testing to see if you have evidence of amyloid beta, which people commonly refer to as plaques, or and tau, which is another substance people will say tau entangles. Um, these, these things are referred to as pathology. And if you were to just go to Google or you were to hear the news, you would hear, oh boy, bad, right? Amyloid bad. It's bad. It's the pathological substance, tau bad. Well, in science and in nature, and in life, things are usually a little bit more complex than that. And it really is. So the Alzheimer's disease bad guys that show up can, research has suggested, be recruited by infections. So if you have, the presence of amyloid beta or the plaques, that may actually be, research suggests, out of Harvard and MGH, Mass General Hospital, that that actually might be a response to an infection, i.e., a immune response that your body has developed over evolution, like literally through the passage of time, to be a defense against infections, which are a predominant issue for human beings and other organisms, right? Is infections. So that piece of information, among other things, our group finds to be really incredibly compelling. And so really to to put the context around like, okay, what does a Lyme podcast have to do with dementia and talking about Alzheimer's disease? We want to understand why the pathology shows up. And it's not to say that it's not bad. I'm going to use an example from another part of the body. So if you get a cut and it gets infected, let's say it's on your leg, you might get like pus, right? It might be filled with pus. If that gets really bad, you might have to go to the doctor. Even though the pus is part of your immune response, it's not helping things. So the doctor might actually lance your wound, drain it, clean it, give you antibiotics. Okay. So you're handling both the infection with the antibiotics, right? And the pus, which is actually the immune response. So with the Alzheimer field, one thing that our group consistently points out is that some people have plaques, right, or have evidence of having increased levels of amyloid beta or tau, but they're not sick yet. They are cognitively normal, like, so their memory is normal. So, what we want to understand as a research team is what's happening, right, preceding those things showing up before, during, and then what leads to this transition of someone going from having those things on board, potentially seeing it on a scan, but then developing memory issues that actually are classified as Alzheimer's or some other dementia. We really feel it's important, though, Fred, to get back to your question about Lyme, to highlight the fact that it is known that Borrelia burgdorferi, the bacteria that causes Lyme disease, can produce a neuroborreliosis, and it can produce a type of dementia. And this is in the medical literature. This isn't conjecture. This isn't a question. And the thing that really is so compelling to me that keeps me awake at night as someone who is a patient, now works in research and is trying to advance this cause, is that routinely speaking, if someone has memory complaints that are new and they go to the doctor, it is not normally on the radar for the majority of physicians to think about testing for things like Lyme. But what we always say is that it's an unquantified subset. So, how many cases could it be? I mean, in 2023, our research group published a paper in the world's leading Alzheimer's journal, Alzheimer's and Dementia, where we basically, with a global group of experts that I pulled together from different domains, we put together what we call a research roadmap, right? How could we figure out which infections could be potentially irritating the system, right? Leading to changes that could result in something called Alzheimer's disease in patients. And one of the things that we did was really scour the medical literature and look for cases of infection and dementia linked together. We found 86 of them.
Mm.
These patients didn't just have Lyme. We found cases where people were diagnosed with viral infections, viruses. We found cases where people were diagnosed with other bacteria other than Lyme, people with fungal infections, and then people with parasitic infections. And what was really sort of startling were that in each of these case reports or case series, that the physician would publish, the conclusion would be the same almost every time. And they would say, physicians should be screening for infections when patients have new onset cognitive issues, cognitive decline. And, we put this out in the world, again in 2023, in hopes of building, an army of scientists, doctors, innovators, people that fund medical research to come together and really convene on the topic. And we're not saying, Fred, that every case of dementia could be infectious. That is far from what is being said. But we are saying that we can't turn a blind eye and not pay attention to the cases that might be by not even screening. We know there are certain issues like The testing for certain chronic infections is far from adequate, and I'm sure Nicole Bell,
Yeah.
would do better justice to this topic, being CEO of Galaxy, where they're really
Yeah.
trying to pick up on infections that fly below the radar, below detection. But um, there is technology already available, testing available that could identify cases that are potentially treatable, where if someone, for example, the Lyme example, if you have memory issues and you have Lyme, and even if you get perhaps an Alzheimer's disease diagnosis, you may potentially benefit from targeted antibiotic treatment by a clinician who is expert in treating chronic infection. And the case reports have shown that certain patients will actually regain memory function and their memory scores improve with treatment.
So, Nikki, as we kind of wind down here, I think the question that everyone who's listening to this wants to know is what should they be doing? So, again, most of the listeners of the Love Hope Lyme podcast, and again, we're talking with Nikki Schultek today, have chronic Lyme. And to be honest with you, there's a lot of fear, when you have chronic Lyme because a lot of things can happen with it, and it can go a bunch of different ways. And, we talked about the fact that testing isn't very adequate, which of course Galaxy and other companies are trying to improve upon. This is kind of a loaded question, and we only have like a minute or two left here. But what would be your message to? I know you have a message to industry, which we'll talk about in a second, or I should say the community, not really industry per se. But what will be your, as we wrap up here, what will be your message to chronic Lyme survivors who are
Mhm.
triggered by Alzheimer's, Lyme disease, dementia? And then I know you have a specific message you want to make to the community to support a lot of what you're doing. So, kind
Yeah,
of
I would
as a loaded question, but it's a question that I'd like you to give your best answer out here.
absolutely. I would say this. People have said, oh, they were concerned about raising the issue that infections could trigger potentially dementia in certain cases, and that could scare people. Currently, I think the scariest thing, having been a patient with, unknown neurodegenerative symptoms, is not knowing what's causing it, and then being told, we really don't have any answers for you. So for patients, there is certain research emerging, and it still remains to be studied further, but certain vaccinations recently, the two consecutive studies demonstrated, and previous studies have demonstrated that vaccinations against shingles can potentially be protective in certain patients from developing Alzheimer's disease. Patients that have concerns about their memory could be screened for Lyme. They can be screened for both, Borrelia burgdorferi, Lyme disease, and co-infections. There is credible evidence suggesting that herpes viruses that cause the cold sores, herpes simplex virus 1 or herpes simplex virus 2, could potentially be involved. And, just having, generally speaking, having a Lyme literate or chronic infection literate physician, which you can actually go to ilads.org, www.ILADS.org. And then there's a provider search where people can look for physicians. I always suggest that, that if people have concerns, have had Lyme, have memory issues, that those physicians are equipped to evaluate, people. So there is hope. There are treatments that can help mitigate neuroinflammation or inflammation that affects the brain.
Yeah, a
Um,
good answer there. So, again, we talked with Nikki Schultek today on the Love Hope Lyme podcast. Again, if you're watching this on YouTube, please give us a thumbs up, ask a question. If you're listening on Apple Podcasts, go up and give us a 5-star review. First of all, Nikki, congratulations on the work you're doing. And uh, it's quite remarkable the challenges that you're taking on because, they affect a lot of people. And, like you're right, you've mentioned a couple times in the show, uh, this isn't it's I tell people it's a ridiculous disease that no human being should have to endure. It's not like breaking an ankle where every doctor on the planet is going to put you in an x-ray and put you in a boot and tell you to sit and watch reruns, for the next 6 months, 6 weeks, and then do, 2 weeks of rehab. There's no podcast on broken ankles. There's organizations that were created, micro organizations, larger organizations, and these are all big challenges because it is the quiet epidemic. It is growing, and it affects people in so many different ways when it gets into the chronic stage, which we're all trying to work on solutions. Thank you again for the amazing work. Do you want to give a final message? I know you're looking for some support
Yeah,
from the community. If you want to share that, feel free.
so our work, you can follow it at www.alzpi.org. So ALZPI is in Pathobiome Initiative. We are a global consortium of researchers and innovators working all literally around the world and really trying to understand which infections might be able to, potentially trigger or drive Alzheimer's disease and other dementias and other brain diseases. And, really, the key thing that we really need at this point in time, definitely the support of our National Institutes of Health, the NIH, to start funding more research along these lines and helping us understand infection-associated chronic illnesses and conditions. Um, but we also, really value the philanthropy community that has come forward to support the work that we're doing. And we always do need more support because without research funding, we can't do anything that we do. So, essentially, we really do need to understand which potential infections could trigger these things, how it works, how it's different from one person to the next. For example, people that have earlier onset disease versus later, and then what we can do to prevent it from happening in the first place eventually. But Fred, thank you so much for having me. I'm so grateful. Thank you for everything that you're doing. And to everyone out listening, what I would say is just to have hope and never give up looking for answers and always find a clinician partner or a partner in your care that hears you and sees you.
Wow. All right. Once again, thank you so much, Nikki Schultek. My name is Fred Diamond. This is the Love Hope Lyme